For many of us, we communicate with each other through our voice. Think about how much you talk every day, at home, at work, or even when you're on the phone. We spend so much time using our voice, but spend very little time caring for it. This is why most of us have experienced a raspy or strained voice at some point. It's especially prevalent among voice professionals like performers, call center agents, teachers, as well as reporters, but it can happen to anyone. On the program today, we'll talk about ways to care for your voice, the different voice problems that you may encounter, and how best to treat them. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk right here on CNN Philippines. Your voice plays a vital role in your everyday life, but it's easy to take for granted. Our guests are here today to give us some tips on how to help keep our voices strong and healthy. With us is Dr. Enrique Papa II, who is an ENT specialist at UniHealth Parañaque Hospital and Medical Center, as well as Hospital ng Maynila. Also with us is Zarina Camille Lazaro. She's a speech-language pathologist from St. Luke's Global City and an instructor of speech pathology at UP Manila. All of us, even from the time we were born, second only to gaining that first breath, gumamit na tayo ng boses natin when we cried, ano? But a lot of us take it for granted, hindi natin inaalagaan. Dr. Enrique, pag-usapan natin, how exactly do we produce sound that eventually becomes our voice, and why is it so distinct? Parang itong fingerprint ng mga tao, iba-ibang mga boses ng tao.
Well, basically for us to produce voice, we need three things, no? First is the power supply, which is the air coming from the lungs. Second is the sound source, which is our larynx, which contains our vocal cords. And third is the resonator, which includes our oral cavity, the nasopharynx, and the sinuses. So basically, for us to produce sounds, the air coming from the lungs is the one that produces the power behind the voice production. The air moves up and down the trachea or the windpipe, thus producing vibration of the vocal cords. The vibration of the vocal cords then tends to produce the sound, which then resonates in our sinuses, oral cavity, or the pharynx, thus shaping and amplifying the sounds. And with the use of our soft palate, the tongue, the mouth, the lips, we then transform these sounds into speech and articulation.
Let's focus on that part where the vocal cords are situated at, no, yung larynx area natin. That's why I'd like to ask Ms. Zarina, ano yung mga ginagawa nating mga Filipinos on a regular basis na nakakapag-compromise ng quality ng voice natin?
Madami po iba-iba kasing causes on why we would have changes in our voice. Pwede rin po kasi yung mga acute na phonotrauma, which are like shouting for a long period of time, using our voice in an abusive manner, like excessive coughing or excessive throat clearing. Even din po yung mga stress that we experience at work, they may also lead to additional tensions in our neck area, which could compromise our voice.
Ms. Zarina, all of those that you mentioned, maybe some acute things, panandalian lang. Are there instances that Filipinos do for long periods of time that in the long run, makakasasama talaga ng boses?
I think Filipinos may have the tendency to talk excessively. I think it's in our culture po kasi na talaga mahilig po tayo makipagkwentuhan, makipag-usap. It's not really a problem per se, but if we talk using an improper voice or hindi po mag-ayos yung technique na ating pakikipag-usap with other people, in the long run, it may lead to voice problem.
One of the most common symptom or mararamdaman ng isang tao na may problema sa kanilang boses ay ang hoarseness. Could you explain to us what hoarseness is and what's usually the area involved when someone is hoarse?
So basically, hoarseness is a symptom of dysphonia. Dysphonia is basically a diagnosis of any changes or alteration in voice production. When we say hoarseness naman, it's basically a symptom for any change in voice quality, pitch, or loudness. Both can either be neurologic, obstructive, iatrogenic, or and most likely secondary to functional, such as vocal abuse.
How much of an impact can certain things that a person does, especially smoking and drinking of alcohol. How big of a factor is this when it comes to someone's voice?
Tobacco smoking can lead to progressive damage in the lining of the mucosa of our vocal cords. Also, smoking tends to lead to an increased mucus production, causing changes in the quality of the voice. Smoking can also predispose the patient with an increased risk of minute hemorrhages or yung mga maliliit na pagdudugo sa vocal cords, secondary to changes in pressure and circulation. And over time, of course, smoking and alcohol can lead to development of tumors or laryngeal cancers.
Now, Ms. Zarina, meron bang connection ang stress level ng isang tao sa quality ng boses niya?
Yes po, there has been research that under periods of stress, the muscles that control the larynx become excessively tense, and periods of prolonged muscle tension in the larynx can lead to incoordination of the muscles that control our voice.
So may connection talaga ang ating stress levels and the quality of our voice. But in some occasions, hoarseness can also signify a serious medical condition. We'll talk more about that when we return. You're watching MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. Now, losing one's voice is a symptom, as discussed earlier, but there may be several underlying reasons. A vocally demanding job or the common cold is sometimes usually to blame. If this is the case, your voice should be restored within a couple of days. But sometimes, it could signify something more serious. Dr. Enrique, pag-usapan natin ang mga possible causes from something like laryngitis, for instance, as a cause for hoarseness or the loss of someone's voice. What are some of the main causes ng laryngitis, and how can this be better managed by our viewers?
When we say laryngitis, it's basically an inflammation or irritation of the larynx causing dysphonia. It could either be acute, lasting for 2 weeks, or chronic, lasting for more than 2 weeks. Here in the Philippines, because of the advent of the BPO industry, the most common cause of laryngitis is vocal abuse. Other causes would include your respiratory tract infections, such as cough and colds, infections such as TB, and also reflux or gastroesophageal reflux disease.
In case, Dr. Enrique, nakapag-voice rest na ang ating mga viewers, but the persistence of hoarseness is still there. Garalgal ang boses niya, very raspy. Is there something probably in their vocal cords that could warrant a checkup with their ENT?
First things first, it's very important that we provide a thorough history and physical examination in any patients who is hoarse or namamalat. It is important for us to ask for history of infection, vocal abuse, trauma, or previous surgery in the neck. In the clinics, the voice can be assessed by having the patient read on a certain text or paragraph and grade the quality of the voice according to scale. It is also very important that we take note about the timing and duration of hoarseness. Because for us ENTs, any hoarseness or pamamalat ng boses that is lasting for more than 2 weeks warrants further examination such as laryngoscopy.
Is there any instance, Dr. Enrique, na ang pagiging raspy ng boses ng isang tao, normal lang to? Kumbaga, part of his character na paos ang kanyang boses, buong buhay na nilang meron silang paos na boses, or should this warrant a checkup? What I'm trying to refer to is, should they be concerned of anything such as maybe a polyp, maybe a cyst, or maybe a nodule?
Basically, if the patient has the same quality of the voice ever since, it is important that we take note of other diseases, maybe anatomic variations in the length or width of the vocal cords, But we must also rule out other causes such as lesions, nodules, cysts, and sometimes masses in the larynx.
You also mentioned some infections, Dr. Enrique, and one of that which is prevalent here in the Philippines is TB. Pwede rin bang, a lot of our viewers know TB as affecting the lungs, pwede rin bang maapektuhan ng vocal cords ang TB?
Yes, because we have what we call your TB laryngitis, because sometimes the infection or the TB cells, the TB bacilli, would actually go through the trachea and infect the vocal cords, causing ulcerations on the mucosa or lining of your vocal cords.
Now let's talk about voice used as a livelihood by a lot of people. And these are call center agents, professional singers, public speakers, teachers. Marami talagang trabaho that rely on their voice as their ways of livelihood. Ms. Zarina, pag-usapan naman natin yun. What is it about the voice care of some, let's put for example, professional singers who are able to sing in a concert night after night, tuloy-tuloy na buo pa rin ang boses, maganda pa rin ang boses, very very healthy. But some people probably partied too hard the night before, the next day wala na yung boses nila. What type of mannerisms, maybe healthcare practices should our viewers know about para ma-maintain ang magandang quality ng voice?
With regards to the frequency of drinking water, it should be, I would recommend to my patients to drink at least every hour. And then for the specific case that you've mentioned, singers are professionally trained, so it's really about vocal technique.
Okay.
So they may tend to avoid caffeinated beverages or alcohol. However, if you do drink those kinds of beverages, it would be better for you to balance the intake with water.
When it comes to our voice, a lot of us have been speaking all our lives, but meron bang tama at maling paraan ng pagsasalita?
There is actually, but it's really personalized from person to person. But my general tips would be to monitor your breathing, make sure that you have air support for everything that you say. Try not to speak at every end of your breath. So make sure that you try to breathe if ever you tend to speak for long periods of time. Also, try to monitor the pitch of your voice since we're not really conscious about yung tono nga po ng ating mga boses. We may tend to speak at the higher end of our voice range or at the lower end of your voice range. So it's up to us to find what our optimal pitch is.
Okay, but Ms. Zarina, Dr. Enrique talked about kung yung power source ng ating voice, which is the air from our lungs. Where should most of that power be coming from for a sustained voice use, especially those who, for let's say, call center agents? It may be hard at first, but where should that power be coming from? The neck muscles, maybe from the diaphragm? Saan ba, Ms. Zarina, ang magandang paraan para mag-vocalize or gumamit ng boses?
It should be from the diaphragm actually, or more commonly, mas monitor po natin siya sa ating bandang tiyan kasi dun malapit po ang ating diaphragm. You will know if you're breathing in an improper way. If you see neck tensions over here, nakikita niyo na po yung muscles niyan. Pero another good way for you to ensure that you're breathing through your diaphragm is to sit in a proper posture. If possible, try to maintain a straight posture whenever you're sitting or standing. So understandable na po na for right now, in our context, majority of the people are working from home. So if makita niyo po na may environmental modifications kayo magagawa, like the height of your table, the height of your chair, it would still be beneficial in the long term.
Later on the show, we'll share some tips with you on how to properly exercise your voice to be healthy as well as powerful. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk, your partner in healthcare. We're talking about today about your very valuable voice. We'll talk about some voice hygiene and your overall vocal health. Dr. Enrique, what should our viewers do in order to maintain their voice, avoid any of these problems? Should regular checkups with the ENT be part of their list?
Well, yes, no, especially for professionals who use their voice frequently, at least once a month or anytime if they feel there's a problem or throat discomfort. Because it is very important that we determine the cause of their hoarseness or pamamalat as early as possible.
When it comes to losing someone's voice, a lot of our viewers may have tried some home remedies here and there. Are there any home remedies to your knowledge na alam niyong medyo may effect din naman?
Treatment lang naman for any patients with hoarseness or pamamalat is basically to lubricate the throat and voice rest. Some patients would try to drink lemon water or turmeric, and sometimes naglalagay sila ng parang luya sa dila, nagsisipsip sila. There's no basically proof that it works, but if they give them comfort, then why not? But again, it is still essential that they do the voice rest and increase their oral fluid.
One of the more serious ailments of vocal cord is that of vocal cord cancer. When it comes to vocal cord cancer, we have to be serious about this, Dr. Enrique, because how can our viewers be very wary about this? What are some of the telltale signs that should prompt them to seek checkups?
Number one, if namamalat ka or namamaos ka, that is progressive and lasting for more than 2 weeks, you warrant already a laryngoscopy. If you find lesions such as nodules or cysts, then we surgically remove that and send it to biopsy. On physical examination, madali namang mag-check if mukhang cancer or mukhang pre-malignant yung lesion. So pag ganun, we do biopsy and we treat it accordingly, either through surgery or radiotherapy or both. The very important thing to remember is that if hindi bumabalik ang boses ninyo ng mahigit 2 linggo.
Now, Ms. Zarina, when it comes to exercising our voice, meron bang mga exercises na makaka-benefit sa power or sa sustainability ng boses sa isang tao? I'm sure aspiring professional singers, maybe call center agents would benefit from anything that will strengthen their voice.
First off, when relaxation, it's really important to maintain a relaxed voice in order to produce a good voice. So some examples of relaxation exercises are just simple stretching of the neck. Yung mga ginagawa po natin pa nag-warm up during workouts, like yung pag-stretch ng neck downward, upward, and even to the sides. You could also do a couple of breathing exercises in order for you to monitor if you're applying diaphragmatic breathing. So you could put one hand on your chest and one hand on your stomach and just inhale and exhale and monitor if mas gumagalaw ba yun sa stomach mo, which indicates that you're applying more diaphragmatic breathing, and monitoring if there are any tensions in your neck to indicate if hindi ba efficient yung breathing pattern ninyo. You could also actually search on YouTube some vocal warm-ups. A lot of my patients find lip trills very easy to do since they follow those videos on YouTube, and I recommend that they do those lip trills before a vocally demanding task.
And with that, I'd like to thank ENT specialist Dr. Enrique Papa II and speech pathologist Ms. Zarina Lazaro for sharing with us your very valuable insights. We learned a lot from you both today, very important information with regards to our voice. Thank you very much. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.